Hey everybody, it is Happy Sunday. If you have not been outside, you need to just stop watching this and get your booty outside because it's absolutely beautiful. So, it's 4 o'clock. It is on Sunday, and we are on part 3 right now of this crazy health history of me that got me to where I'm at today and why I birthed Kidney Health and Wellness. So if you have not seen the other 2 videos, I encourage you to go ahead, just dive on back into Facebook and you can kind of start at 1. You're going to get an idea of where we were and how this is brought forward. But right now we're going to dive off where I left off, which is I'm just married. So just married and living in an apartment with my great, awesome, amazing, brand new husband. He is doing his brand new job as well. I was working nights while I was going to nursing school. And with that being said, lots of stress and not a lot of sleep. Kind of my MO on everything. We also were looking at building a house. And so he's pretty awesome and utilized a lot of help from his family and built our first house. Really cool. So here we are. We're married for a year. We move out and we move into his parents' house until the house was finished. I passed my boards and took a new night job as a brand new nurse. Loved it. Lots of stress, lots of emotion, but super fun. Found out I was pregnant. That's what we were hoping for. We were trying to have a family as we were a little bit younger side and really wanted to get going on it. I did not feel well with that pregnancy. I felt like I just felt ishy all the time throughout the entire 9 months. Did not throw up like some women do, just felt really icky and really tired. On the flip side, though, I ended up having an amazing, beautiful vaginal delivery, healthy baby girl, and worked on breastfeeding the best I could. I say that because there's a lot of issues with the latch. And I made it about 2 weeks while I was pumping, bottling, trying to nurse her, trying to figure it all out. Just didn't make it happen. And so a lot of anxiety went into the decision to not nurse her and to go to formula feeding. And that was kind of a big thing that I was struggling with internally. Fast forward, though, a few months, and after the birth of this child, there was a big emotional thing that happened. About a month into my daughter's life, I found out that my grandmother, who was just like a mother to me, very, very special woman, she ended up having advanced stage bone cancer and passed when my daughter was about 3 months old. Huge issue, huge blow. My typical emotional response to many things throughout my entire life were to just suppress my feelings and just move on. Served me really well in my nursing career, especially in ICU settings, because you need to focus on what you're doing. You can't deal with the outside stuff. Very poor choice of management when it came to managing my own personal feelings in my life. And we'll get to that as life progresses for me here. So start working through things. Not very well, to be honestly. Again, suppressed a lot of those emotions. But fast forward, continued to work nights, continued eating pretty much a crappy diet. Night shift workers, you very well might identify with this. Often when we're really tired, we tend to crave carbs, and we tend to try to keep ourselves awake with a lot of different things called caffeine and sugar. So that's pretty much what I lived on, sugar and caffeine, because it kept me awake when I needed to be awake, and I didn't sleep well. So with the lack of sleep, it usually caused some sort of a craving. Not really fun. When my daughter was about a year old, I had another really traumatic emotional event happen in my life. My father died. It was sudden, it was very abrupt, and he ended up having a massive heart attack. Hit me like a brick. And adding on top of the idea, I had just started a brand new job in an intensive care. Not a good time. So in addition to not sleeping prior, I really wasn't sleeping. When I wasn't sleeping, I was usually thinking, trying to work through just grief process that I was having. I had that 1-year-old at home. I felt really disconnected, to be very honest. So forget the idea of eating anything good, and just really much just kind of struggled to be living. In the middle of all of that, I continue to have headaches. This has been an ongoing issue for me, that I was trying different things with therapy, different types of mouth guards. I pretty much lived on ibuprofen. In fact, those really big bottles that you could get at Target, they were my big thing. I literally was slamming ibuprofen like there was no tomorrow. So fast forward, I just struggled. I struggled for quite a while, and we had moved into our house. Things were going well. As well as they were. I mean, I was functioning and living and trying to be the best mom I could be while I felt like I also was just kind of falling apart. I end up finding out that I'm pregnant again. And this is really awesome. It was about a year and a half after my dad had died, and we were really excited to have another baby on the way. This time I felt horrible still. Tap beer hangover was what my joke was, and I would throw up. So at least I'd throw up, because then that allowed me to eat, because I was actually hungry. My diet of choice with the second pregnancy was SpaghettiOs with cheddar cheese and chocolate ice cream. I don't know why, but that is what I craved, and that is what I primarily ate, in addition to all of the different Diet Cokes, coffees, and other things, because again, I was working, trying to figure out how to navigate and manage and not sleep with now this baby inside me. I took another job right before she was delivered, and I started working in a labor and delivery setting, so brand new job, and then have baby number 2. This time, it was a great, again, good vaginal delivery, no complications, no issues. I was determined to make breastfeeding work. So I tried to nurse her, and she was nursing all the time. My latch was a little bit better. But about 2 weeks into her life, we found out her jaundice was super duper high. And in fact, it was encouraged that I actually stopped nursing, related to the fact that I just didn't seem to be producing much milk in order to sustain her. She wasn't gaining weight. Reason that's important is once I went cold turkey, I really didn't have any engorgement. So I wasn't really making a lot of milk at that time. My anxiety was through the roof. And if I look back in hindsight, I would like to say postpartum depression and anxiety was definitely a huge thing going on with this. So fast forward, I go back to work. I'm working, again, nights, labor and delivery, brand new facility and world, new everything, lots of stress related to that job, and not sleeping with 2 children at home. So again, consistently, you're kind of seeing I don't sleep. I have major headaches. My diet's horrible because it's to just keep myself awake. Can anybody identify with that? That's kind of a normal thing. Unfortunately, it is very, very common. Again, I shouldn't say the word normal. It's not normal, but it's very common with many, many people. So fast forward, one other thing that was kind of interesting, I had started working in the holistic ideas, so to speak, of the world, in the fact that with my second pregnancy, I had a lot of issues with my hip and it kept popping out. So I sought chiropractic help. And so we put it back in. So just keep in mind, the right hip has been an issue. It wouldn't stay when I was pregnant. What else? Let's look here. I'm trying to keep myself going here and on the right thing. While I was working nights again, we knew we were at a poor diet. About a year after that second baby was born, we were in the process of selling our house and building another one. Gotta love it, right? You know, let's just keep adding on the emotional stress. So with that, 2 small children at home, working nights, not sleeping, not eating correctly, selling a house, building a house. Transition time where we were living in an apartment in between the second house. We get into the second house, and at this point, this is when my husband stepped up and he said, you need to go to the doctor. Something's going on with you. You are crying all the time. You are not doing well, and you're not responding well. Something's off. I did go see the doctor at that time and was diagnosed with anxiety and depression at that point. This time I went on medication. Now, with that, I did not like the medication. The medication made me feel just numb and icky. And either it was the flip side of not being able to control my emotions or being really just kind of off the wall crazy, in my opinion, of just super reactive and really crabby and cranky with everybody, or this numb feeling. I didn't like either one of them, but this was what was going on according to the diagnosis. So I proceeded to take these meds until I chose not to, and then would go back on and go off and go on and go off. This is not what I'm promoting. However, this is what I chose to do. So fast forward a little bit. We kind of just managed the best we could, dealing with the kids and living and having stress and trying to work through all of these different things. I then started having some weird things happen with my back. I had bent over and picked up a towel, of all things, and ended up having a shooting pain that went down from my back, through my butt, all the way down my leg. And if anyone's ever experienced that before, that is the classic diagnosis of a disc issue, for example. So I went to multiple doctors, multiple specialists, multiple therapy programs, and never could ever get to the root of what was going on with this pain. Finally ended up at the University of Minnesota and saw a spine surgeon, who then said, well, this is very interesting. And when I look at the imaging and when I see this, it looks like you have a broken back. What? That's crazy. So if you looked at it, there were little bone fragments in my spine. Now there's in your pelvis, there's the big bones that stick out. And then in the back, there's this triangle piece and it's called your sacrum. And it's a bunch of little fused little bones. So there's the sacrum and then there's the spinal cord that sits on top. I had little bone fragments kind of in the area between the bottom vertebrae and then that triangle piece. And so I tried one more therapy program that he recommended. Did not pass that program, actually still continued to have a lot of the problems. And so the decision was made when my youngest child was 4 years old to go ahead and do a spinal fusion. So what he ended up doing is he put 2 rods in my back to fuse my spine to that triangle piece of my pelvis and cleaned out all the little bone fragments. You know, it actually worked for about 3 months. After 3 months, what happens sometimes with fusions is you stop the movement that needs to happen in the body. The body's supposed to move all over the place, right? We stopped the movement, and then that caused more issues in the pelvis. The pelvis wasn't working correctly, and the idea I was having tons of pain. So what I ended up doing at that point, I started having injections of cortisone into the SI joint that was super mobile in my body. That hurts really bad, but it did relieve some of the pain that I had in that joint. I then sought out different physical therapists, and this one actually had a different idea. She said, you know, I think there's something going on with how your body's alignment is, and I bet if you actually adjusted your jaw, you would feel better. So I found a holistic dentist. And wouldn't you know, I went through 3 years of management with this dentist and actually adjusted my bite utilizing different types of things as well as braces. I got the bite down to the point where I didn't have any more issues with my back and my pelvis. So it was actually pretty cool. It was very effective. At that point, I think we're going to cut it right now. We're going to stop this conversation. We're going to have part 4. So I have had a spinal fusion. I have had my jaw realigned in order to help my spine. Crazy stuff, continuing to have some headaches, but we're going to come back post-fix in probably, let's see, how about if we come back in 2 days? I'll come back on Tuesday. What if we did Tuesday? We could do Tuesday at... let's try 3 o'clock. So Tuesday at 3 o'clock, I will jump back on. We'll do another live and I'll take you on the rest of the journey. Okay. You guys get your booties outside. It is gorgeous and beautiful. And I'll talk to you in a little while. Okay. Bye-bye.